So early exposure to family medicine already broke down all those wrong mindsets about it, that oh, it's for women, it's for this. Nah, there's no specialty that you can say is for women. This one is for
Everyone, welcome to the Excellent Lady Doc podcast. It's nice to have you here once again. And we have with us here today Dr. Sarah, the very amazing Dr. Sarah Michael-Duja, a senior registrar in family medicine. She's also a mother. She's a pastor's wife, and she does all these wonderful things. And so we'd just like to ask her some questions as upcoming doctors. Stay tuned to us. So, Dr. Sarah, it's nice having you here once again.
nice being here again.
So firstly, today I would be asking what led you to choose family medicine as a specialty?
What led me to choosing family medicine as a specialty is because I had an early exposure to family medicine from my institution of training. That's my medical school. Most institutions don't do family medicine as like a full course that you will do MB for it and all of that. But there, in Bowen, we have family medicine as a full MB alongside pediatric and O&G. Yeah, so family medicine is a big deal in Bowen. And, it was formerly the Baptist Medical Center and is one of the leading centers for family medicine in Nigeria. So that early exposure to what family medicine was and what family medicine is, and then seeing how the doctors, the family physicians interacted with their patients, comparing that with um, other specialists, the way they interacted with their patients, it felt like something was missing in other places and it was right in family medicine. That is one of the things that pushed me to going into family medicine. I wanted to um, go beyond treating the patient's body. Family medicine uses biopsychosocial model. You see the patient as a whole, not
Yeah.
just the body not being okay, but we see everything and we just want to explore that things that could influence whatever was going on with them. And I love that. So yeah, that was it.
Yeah, yes. Wow. We that's actually, I mean, in our school we don't have family medicine as a whole, like maybe a course that we do and write MBA. No, we don't. Like I feel like most of us we don't even really know what family medicine entails and things like that because we don't really have exposure to it like you did in your medical school.
Yeah.
So
And permit me to cutting. Most people, just like you said, they don't know what family medicine entails, and they just feel that family medicine is the specialty for women. There is that stereotype that you just sit down in GOPD, go 9 to 2
yes.
p.m. and then you go home and take care of your family. That's the mindset a lot of doctors have. And, specialists also have this mindset that family physicians are they are jack of all trade, master of none, which is also wrong. Do you get that? So
Yes.
that's also wrong. So early exposure to family medicine already broke down all those wrong mindsets about it, that oh, it's for women, it's for this. Nah, there's no specialty that you can say is for women. This one is for men. That's wrong. Okay, that's wrong. So you can
Yes.
continue.
No, it's very important. I would even like for you to tell us a little bit about what family medicine is about. Like you said, most of us, we don't really know what it entails, what it's about. So you can just brief us a little bit so that we that don't have that exposure to the medical school can know about.
Okay, so family medicine is a specialty that takes care of, we don't have a bias towards the patient's age or the condition. We say that we treat patients from cradle to grave. Of course, it's not possible that you will treat one person from when they were born to maybe when they grow to 90. We just say that treat patients from cradle to grave, from the point of birth even till they die. Every part of the body is important, okay? But beyond the body, also care about the mind of the patient. That is the psychological aspect of the patient. We also care about other external factors that could influence a patient's well-being, okay? We care about their environment. We care about their caregivers. Okay, because sometimes you wonder why someone who has a family, let's say a man has a family with children, and then another man has his own wife and children. Both of them have diabetes, but one person's blood sugar is well controlled, the other person's sugar is not well controlled. You might wonder, you might even increase the medications or change to insulin and think that, okay, maybe it's not just responding to, but you don't know the issues in the family that is actually influencing that poor glycemic control.
Mm.
Because one person, the wife might be supportive. The wife might say,
Yeah.
oh, okay, this is what everybody is going to eat. I would ensure that you have your dinner before 6 p.m., you get your medications every day. While the other man has, family problems, okay? He has a dysfunctional family, all right? So we have things that we call
So,
family medicine tools. These are tools that we use to assess a patient's family function and also his relationship with others, okay? How these things can affect their care and their overall health outcomes, okay? The family physician is not just a doctor, okay? The family physician is a researcher. The family physician is an advocate. You advocate for your patients. The family physician, the family physician is an advocate. The family physician is a resource manager. Okay, we manage resources. Now, I work in a low resource setting right now. When a patient comes in, unlike places where all the patients have all the money, you can just write all the investigations, full blood count, EUCR, blah blah blah. You just request everything. But here you are thinking, this old woman just come in and say, "Doctor, I have this, I have that," and then you say, "Mama, this thing you need money." She say, that all she has is 4,000 naira, and you're wondering,
wow.
out of 4,000 naira, you're supposed to buy drug, you're supposed to do lab tests. What will
Yeah.
I do? You manage the patient's resources, so you determine what investigation is most important right now? What will tell me? What will lead me to my diagnosis? What's the most important one? This is not the point to order everything, okay?
Yeah.
This is the point where you sit down and think, okay, what can I do to assist this woman? All right. Now, of course, family physicians also work in centers where there is abundance of resources. Now, you manage human resources as well. I just gave an example of financial resources, especially in set low resource settings like where I work. Okay, you manage human resources. Okay, you're a manager, so you don't just manage cash. You manage human resources. You also manage resources in the hospital. You shouldn't waste things. Some people are very fond of maybe when you're in clinic, you want to scribble something, you just pick one investigation paper and you just turn to the back and start scribbling. You're wasting resources. You're wasting material resources. So there are three things the family physician manages. Manage money, you manage man, and you manage materials. Okay. Yeah. So
Thank you so much for enlightening us about. I love the three M's: manage money, manage man, and you manage materials. Yeah, thank you so much. So while we're doing introduction, we mentioned that a doctor, you're saying mother, and it's a lot. So we want to know how the motherhood journey has been. How has it been for you? And what advice we have for people that are still planning to be mothers?
motherhood has been interesting. It's a beautiful journey, a beautiful experience, I must say. Sometimes people think about some things and they're like, they want to think of it in terms of the rewards that they get, maybe physical rewards, but I dare say that nothing physical can reward being a mother.
Mm,
It's something deep. It's a lot you are
mm,
giving away. You're practically giving your life away, from the moment of conception, the sacrifices you make, consciously, unconsciously. Unconsciously, your body is making sacrifices. You're not thinking about it, okay? But, your body will allocate resources to your
yes.
uterus. Your body will allocate resources to your baby. You're not the one that will tell your kidneys to start. No, you don't tell any organ. Your body will do the work. Okay. So you make sacrifices. The conscious ones you make, when you're thinking, you start thinking of, okay, my baby this, my baby that. You want to buy something and then you realize, oh, I can't have this now. It's not good for my health. Oh, this one is not good for the growing baby. Or even after you've had your baby, You're thinking, for example, you want to just get up and go for a conference. When there is a child, no, you can't just pack your things and go. You have to think,
Yes.
where will I put my baby? What will my baby eat? You have to plan, you have a plan for their feeding, diapers, and all those things, paying school fees. It's a lot, though. So,
Yes.
motherhood
Yes.
has been good so far. I'm grateful to God. It's been beautiful watching the little one grow from being in a neonate, that moment when you carry them and you're just so fragile. And then
Yeah.
growing up and having teeth, running around the house, and you just wonder, how did we get here? Like,
Yes.
you were just a baby yesterday. Now you're running around,
Yeah.
been beautiful and I'm grateful. Motherhood has been great, thank God. Of course, it comes with its challenges, and the challenges I mean lots of sacrifices, things I want to do, but I can't really do because I have to put a little one into consideration. That's a
Yeah.
lot, really. When you're at work and then your mind will just go there, oh, my baby, what's he eating? Is he fine? Is he okay? Before you could just work, 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 work. I would work late into the night. I would stay in the hospital for long hours and not even look back. But now I can't. I dare not. I want to go back home. To go back home. Yeah, so motherhood has been great. Yeah, requires a lot of sacrifices too.
Yes. Well done, ma. Well done.
Thank you.
Yeah. A lot. I've heard a lot about it. So, moving on, I'd like to ask that did mentorship play a role in your career so far? And
Yeah, mentorship has played a huge role in my career, will not lie. So during my house job, I said it that I wanted to do family medicine early, made that decision early. During house job, I did my primaries. Of course, at that point, I didn't have a mentor. I had not come across EIM at the point. So I wrote my primaries in national with the national college and I passed. So I resumed residency immediately after NYSC. I did my interview during NYSC. So immediately I finished, I just resumed.
wow.
So that's actually
Wow.
made my journey quite fast. So
Yeah.
right. So that has made my journey to be fast. And at the time I met Dr. Jumi, that was very early in my career, that was like some months into residency, about 4 months into residency. I had an idea of where I was going, but I didn't know how to get there. Okay, so I talked to Dr. Jimmy and then Dr. Jimmy thinks now, okay, you will write this down, and she started polishing me here and there. And my attitude to work also changed. The name of this network is Excellence in Medicine. I started doing things differently. All right. And that impacted how my consultants perceived me at a point, because they were even surprised, like, how are you doing these things? You're doing so many things at the same time and you are not lacking at work. Like, if we call you to work, you show up. There was a particular day, it was a weekend, I wasn't on call. I lived in the hospital at the time. So the consultant just called me, oh, doc, there is a patient, blah, blah, blah. I want you to go and check on this patient. I said, okay, sir. I dropped everything I was doing. I went there, got back. I gave him a response. He said, that was so fast. How did you do it? Yet I had other things. And I remember there was another day, one of our doctors ordered a cake and he was like, please, I need this in like few hours. I said, no problem. I didn't even have a staff at that time. Guess what?
Mm.
He got his cake before the time he needed it. And then he was just wondering, like, how did you do it? Did you? Yeah, so mentorship had a role to play. There were times when I felt like giving up on certain things.
Um,
My mentor, Dr. Jimmy, she will not allow. She will just say, Sarah, no, you cannot. Stop this. And that has helped me so far. And then at the point when I wanted to take a decision on doing exemption for West African College or not, she was also very instrumental in telling me to go ahead because I was very concerned about the financial implications but then she was there to encourage me all the way and helping me see make plans for my part one. How do you want to pass? What's your plan? How do you want to study? All those things, holding our hands, making us see possibilities. Early on in EIM, she would bring different consultants from different specialties. They'll come and talk to us on various things. We have career webinars and all those things. And those things opened our minds. In fact, sometimes I go to my journals, the journals I used to write back then, and I would see some things and be like, wow, wow, this is a lot. We learned a lot, and those things have helped us. And yeah, one last thing I want to say is visioning. One thing Dr. Jimmy did for us in EIN is that she ensured that we all wrote something up in the next 5 years. Where do you want to see yourself? I didn't realize how powerful that thing was until recently. I think early this year when I went back to my journal and then I saw that because it's at a point that last year, to be precise, it felt like I stopped pursuing the things I wanted to do. I told you now that motherhood is like you give a lot of
Yeah.
sacrifice. And for me, it felt like 2 years was on hold. The year I was pregnant, and then the first 1 year. That period is intense. That
Yes.
year of pregnancy is like 9 months now, and then 1 year
Yes.
after it's almost 2 years. So
Yes.
it's such an intense period, and it's like I wasn't even pursuing anything I really wanted to pursue. So early this year, I picked up my journal, and exactly the things I wanted to do back then, I had written them again. So I compared, and guess what? They were exactly the same thing. So it's not like
Wow.
just pick up from where you stop. And now the previous writing was very important because it helped me to see that you're still on the right track. It
Yes.
helped it helped me find my path that, oh, okay, you're on the right track. So just go ahead. You don't need to be afraid. Okay. Don't let me say too much again. Stop
And
there.
we love it.
Because if
We
I
love
been very
it.
instrumental, my
Yes,
progress.
yes. I count it a blessing, to a huge blessing. Like to have doctors like you, Dr. Shira, that have gone ahead, you've experienced it and you can lead us on the right path. Like now most of us are just I would not say really clueless, but we need mentoring. That's just the mentoring. So I see that a very big
Yeah,
blessing.
you guys are
Yeah.
blessed because as a medical student, I didn't have this kind of exposure. It was very far away. I told you
Yeah.
that I came into EIM few months into residency. I didn't
President.
even know how I was going to do it, but yeah, God made our paths cross. They are here today, making
Yes.
progress in the right direction.
And thank you. So we've spoken a lot about medicine, career, and everything. So now I'd like to ask if you have other passions aside from medicine and how that has contributed to your overall well-being.
I love baking. That started during house job. I didn't start baking during house job, but I picked up the interest during house job. So I would just see some things on Instagram, cakes, and I'm like, this is really nice. This is so creative. This is that. So yeah, I was like, okay, I think after house job, I'll go and learn this thing. Meanwhile, my mom is a caterer. She used to bake growing up, but I didn't like it because we used to do most of the house chores, we clean up after her and washing
Yes.
plates, those things now,
Yes.
they were
I
not
hate
so
that.
exciting. Those things were not exciting at all.
Yes.
So
Yes.
didn't like it. But as an adult, the interest came and then
So,
I was like, okay, let's give this a try. And then I took baking lessons and I started to sell cakes, I started to sell cakes, one cupcake at a time. I met people who were instrumental to opening up a market for me. They heard that I was baking. They saw that I was baking. I made posts. Okay, I think I should talk about this in full, about my journey in baking. I think it will help someone. When I started um baking, that was the year when I was doing my NYSC. No alawi, nothing. No alawi from the state, just from the federal government, which was 19,800 at the time. And as a doctor, I was not going to
wow.
get paid. So they're just going to pay me at the end of my um of the service year, which was not
The whole
nice.
truck.
Yeah, they wanted to pay me a lump sum at the end of service year. So that means I'll be living on 19.8, which was not nice for me. I felt like I have to get another source of income. So I started selling cakes bit by bit, that was how I started. And then any opportunity to bake and decorate just to practice, I would do it and post it on my WhatsApp status. So that's how people got to know what I was baking. When Mother's Day came, I baked a cake and surprised my mom. I posted it. In
Wow.
fact, there were times when I would just bake and decorate just for the sake of practice. I would just do that, post, and then
Yeah.
people started asking me questions. Oh, can you do this? Can you do that? And I would say, yes, in the affirmative. Yes, I can. I've not done it before, but the confidence was because I believed I could do it. I believed so much in myself that even though I've not done this thing before, I would now go online, watch videos, watch lots of videos, reach out to my trainer, ask her questions, and then I would do it. And they were like, wow, this is so good. Blah 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 blah. Making six figures
Wow.
monthly. It's a
Wow.
big deal. So
Wow. Yes.
that's
Yes.
growth. So yeah, I do baking and I'm happy with it. So how has it impacted my
Mm,
overall well-being? It makes me happy. I love cooking generally. So
mm.
sometimes even when I am stressed,
Oh,
if you say, what do you want to do? I want to eat so. Okay, let's go and buy it. I'll say, oh, I want to cook it myself. Or rather cook it myself my own way to my taste. Stressful. I mean, the entire process of shopping for ingredients and then staying hours in the kitchen to prepare this, but you can't tell me nothing. I'm going to cook it.
wow.
If I eat out, I won't be satisfied. So I want to eat my own. So yeah, it makes me happy. And then I
Wow.
love the fact that my baking brings smiles to people's faces. It's somewhat similar to what medicine does. In medicine, when you treat people and they get well, they are grateful, they are happy, they are thankful. In
Mm,
baking, when I make their cakes, they are happy, they're excited. I always love the
really.
response. Oh, my cake was so beautiful, wasn't it? Yeah, makes me happy. So positive feedback.
Yeah. For cooking, for baking, I think I'm like the opposite. I don't enjoy cooking.
You
I
don't
enjoy it,
like
but I
it?
don't enjoy it. I feel like it's stressful. The baking too, but the washing after I really I don't like that too. But I enjoy crocheting. For hearing your story, how like you're able to like just do it and all, I think encourage you to try to pick it back up because I really enjoy doing it too.
You may not even do it as a business. You can do it for leisure. If it's going to make you happy, yeah, why not?
Yeah, I'll take that and I'll work on that. Okay. It's been an amazing time so far. Very, very, very amazing time. I love the stories, all the experiences you've shared with us. And just finally, I'd just like to ask for any advice that you have for young women in medicine that are coming up. But
Okay, for young women in medicine who have other passions, my advice to you is that take one step at a time. Don't be in a hurry. Yeah, you might look at others and say, "Oh, I want this exact thing," but do a self-assessment, consider where you are, and make the best use of whatever you can with the little resources you have. I remember how I used to take pictures. My Instagram page, Sarah Deli Streets, you can go and check my Instagram page, how I used to post a lot of pictures. In fact, I took classes in photography at a point just to put out good pictures for people to see. And I actually did not have a studio I didn't have a bakery. I didn't have, but the way I will set up and the way I will take that picture, you will not know. You will buy cake. You can move, no matter how little the resources you have, no matter how little they are, you can make the best out of it. Be intentional about creating content that will put you out. There's nothing in you from putting yourself out there. Just like we say in EIM, put yourself out there. If you don't do it, nobody will do it for you. And I would like to give a scriptural reference. Even Apostle Paul, at a point in the book of Philippians, he said that, well, all these things, I don't reckon everything. I don't reckon, who I am. But at a point, he had to give us a lowdown of his profile. He said,
Yeah.
I am a Jew, circumcised on the 8th day. About the law, I am a Pharisee, persecuting Christians. He had to put himself out there at a point so that people will not just look at him like, who is this guy? He's just always preaching. No. Put yourself
Yeah.
out there as much as you can, okay? Because if you don't blow your trumpet, no one will blow it for you.
Yeah. Thank you. Thank you so
You're
much.
welcome.
Thank you so much. So we have our final word. So all our listeners there, put yourself out there because nobody will do it for you. So we would put ourselves out there. So thank you so much, Dr. Sarah, for being with us on this podcast. We enjoyed having you with us. Thank you so much. And thank you to our listeners for being with us to the end. I believe that you enjoyed this episode and we hope that you stay tuned to our next episode because we have a lot of exciting things for you. So thank you. We remain excellent in the Doc podcast and we hope to see you next time. Bye.
Today's episode of the Excellent Lady Dog podcast. If you like what you've heard, don't forget to comment, share, and leave us a review. Follow us on social media at Excellent Lady Dog for more inspiring content. Until next time, keep striving, shining, and being excellent.